Today on Not Everybody Wearing Scrubs is a Nurse or a Doctor, we're going to talk about clinical lab scientists. If you like science, precision, and being behind the scenes, this is for you. So clinical lab scientists, they're required to have a bachelor's degree in either biology, chemistry, microbiology, or medical laboratory science. Now, this is a strong science heavy role, so your lab foundations do matter. Now, you'll complete your prereqs, you'll get your bachelor's degree, and then your organization will train you. Most likely, it'll be the hospital. This is about a year after your degree. A lot of the programs are highly competitive, but unfortunately, this position is really understaffed because a lot of people don't know about it, and it's kind of like gate kept until now. So after you do your training, you have to pass a certification exam, and that'll certify you nationally. Now, some states actually have their own requirements and certifications, so you have to see what your state requires for this. Now, after you get certified, you're able to start working in the lab. This could be in the hospital and blood banks, reference labs, and even outpatient or specialty labs. You'll be running tests that'll guide diagnosis and treatments of our patients. Now, while CLS is not really, in direct face of the patient, it's definitely important. If the labs go wrong, our care goes wrong, and then it could be detrimental. It could literally be life and death. Not everyone wearing scrubs is a nurse or a doctor. Today we're going to talk about EKG or telemetry monitor techs. This job requires you to have a high school diploma or a GED, no college degree required. You're going to complete the EKG telemetry training, which may last 4 to 12 weeks. It's offered at hospitals, community colleges, and vocational programs. You're going to learn heart rhythms, lead placement, and rhythm interpretation. Now, once you understand the normal, then you're going to go to the abnormal heart rhythms. This is dysrhythmias, and the life-threatening changes like VTAC or heart blocks. Then you're going to get certified. Sometimes it's preferred, but go ahead and get certified. You're going to go, this would be through NHA or CCI. Then you're going to start working, right? You could be employed at hospitals, ICUs, step-down units, and cardiac floors, and even sometimes outpatient units that are doing like remote monitoring. You may never enter the patient's room, but when you catch a rhythm change, you're saving a life. Everyone wearing scrubs is not a nurse or a doctor. Today we're going to talk about respiratory therapists. Now, if a patient can't breathe, this is the specialist that everybody turns to. Now, let's talk about how to actually become one. So the basic requirements is you're going to go through a respiratory therapy program. This is going to be either an associate's degree or a bachelor's program. You're going to have clinical training, hands-on rotation in hospitals, working with oxygen devices, mechanical ventilation, arterial blood gases, and critically ill patients. Then you have to pass your national board exams. Then you're going to get licensed in your state or multiple states. But the board exams allow you to practice nationwide. Then you're going to get started working. You can work in the ICU, emergency department, NICUs, step-down units, pulmonary clinics. You manage airways. You manage the ventilators in the ICU or critical care settings and breathing treatments. The opportunities are endless. Welcome back to Not Everybody Wearing Scrubs is a Nurse or a Doctor. And today we're going to talk about radiology techs. So, radiology technicians are the ones that perform x-rays, CTs, MRIs, and things under fluoroscopy. So, before a diagnosis is confirmed in healthcare, imaging is usually done, and that's like the testing to tell the story. So, radiology techs are trained to position the patients correctly and with proper body alignment, right? So we don't have extra pain or contractures or injuries to the patient. They operate the imaging equipment safely and minimize radiation exposure. A poor image that's unclear, foggy, or of the wrong area can delay diagnosis or require repeat scans. Most radiology techs, they complete a accredited program. That's about 2 years. Now, talking to some of the techs at work, they say generally you could start in X-ray and then you progress to CT and then MRI, and each one requires like a little bit more of training or certification in that area. Now, you can get this from technical colleges, vocational colleges, and even some hospitals have their own training programs. Radiology is a great field. You could do this, like I said, at hospital facilities. You could do this at outpatient settings, and you could do it local or travel positions for this position. The labs tell you what's happening chemically, but radiology actually shows you what's happening physically. For example, if a patient comes in with stroke symptoms, we're going to most likely do a CT to show us what the inside of that brain is, whether it's a bleed or it's a blood clot. As well as, like, if you break a bone, right, they're going to do an x-ray at the bedside or a standing x-ray just to see if there's a fracture at that site. Just something to think about. Not everyone wearing scrubs is a nurse or a doctor. Let's talk about case management and social workers. So case management and social workers usually are behind the scenes. These individuals come when you're admitted and before you're discharged from the hospital or the facility. So discharge does not just happen because the doctor says so. There are some things that have to be in place to make sure that you're safely discharged. You have what you need, whether it's medications, your errands are set up, transportation, and other things to assist your activities of daily living. And this is coordinated by the case managers and social work. So they arrange home health, rehab placement, equipment, insurance approvals, transportation, and community resources. Without them, patients get discharged unsafely, or readmitted very quickly, or stay hospitalized longer than actually needed. So this role helps prevent readmissions, delays, and gaps in care. Case managers can be nurses or social workers, while social workers can complete specialized training in counseling, resources, and advocacy to perform their job. So these roles, they don't just move patients in and out of beds, they actually protect patients after they leave. Not everyone wearing scrubs is a nurse or a doctor. Let's talk about the two main positions in the pharmacy: the pharmacist and the pharmacy tech. This is the safety net behind every medication. So nurses don't just pull medicines off the shelf without having a certain process. It's a whole system protecting patients first. So first, the doctor is going to put in a medication order. It is going to be verified by the pharmacist. It will be prepared by the pharmacy tech. Then it would be sent to the floor for the nurse to administer. And then, of course, the nurse goes through her 5 rights before giving the medication to make sure it's to the right patient, the right route, dose, and time, and all the other things. So in the hospital, pharmacists, like I said, they review the medication and they verify the orders before it ever reaches the bedside. They're going to check the dose, the allergy, interactions, renal function, and appropriateness for this patient's condition. The pharmacy technicians, they prepare, label, and dispense the medication, while the pharmacists serve as the final safety check. If something looks unsafe, pharmacy can stop an order before harm happens. So pharmacy techs in most states, actually, it's a certification. And I had checked like a few months ago. It's actually pretty quick to get because I think they're understaffed. And so some of the requirements, it makes it very easy to get your pharmacy tech certification without even really going to school. Places like CVS and Walgreens, I think they're doing on the job training. So that's something to look into. Now, as far as the pharmacist, that is a full degree, and it's actually a doctorate of pharmacy, a doctorate degree in pharmacy, and they're licensed professionals, of course. So now pharmacy techs, they have a short training program, and they can actually work in places, like I said, the pharmacy stores like Walgreens and CVS, in the hospital, there's private pharmacies that kind of service like long-term care facilities. You could possibly work with the animal sector. So there's a lot of different opportunities in this position. So medication safety doesn't start with administration, it actually starts with verification. This is just one more job in healthcare that people are sometimes unfamiliar with: the pharmacist and pharmacy techs. I hope this helps. Not everyone in Scrubs is a nurse or a doctor. Here are 7 healthcare jobs you probably didn't know existed. Clinical lab scientists are real scientists that work behind the scenes analyzing your blood, urine, and cultures under a microscope to guide diagnosis and your treatment. Number 2, phlebotomists. These are the people that come and draw your blood, making those labs possible. Without them, there are no blood results. Number 3, EKG and telemetry monitor techs. These people, they watch your heart rhythms around the clock. They check for any life-changing rhythms, and they call the nurse to get them to bedside and to treat whatever is going on with the patient. Number 4, respiratory therapists. Now, these are the individuals that manage oxygen, supplemental oxygen, your breathing treatments, and they just overall monitor your respiratory status. Number 5, radiology technicians. These are the people that perform x-rays, CTs, and MRIs, and they can confirm what's going on inside the body. Number 6, pharmacy. So either the pharmacist or pharmacy tech. These people, the pharmacist verifies the medications after the doctor orders it. And the pharmacy tech, they'll prepare the medication, which means they'll either count it or draw it up or prepare the bag, and then send it to the nurse to administer it. Now, lastly, case manager and social workers. These people, they coordinate safe discharges for our patients, and they help with the overall long-term care plan to make sure that the patient doesn't continue to be readmitted or have to see acute care. Now, all in all, like I said, everybody in Scrubs is not a nurse or a doctor. Healthcare is not just one role, it's a team, and every role is important.